Let's get right down to it. It's only your third day on the job. I understand that. But this is in the midst of what many are calling a healthcare crisis. What do you say to Canadians who can't find a family doctor, and some are seeing their emergency rooms closed at times?
You know, it's never been more important in the history of our healthcare system for patients to become health literate. Health is one of those things that unless you're in care or you have a close family member or friend who's going through care, that you keep in front of mind and you actually understand what's going on. Patients who are coming into the system are not happy with their experiences. Providers are not happy with the support that we have. We do need urgent action to actually fix and repair the system, make sure we stabilize what's out there right now so we can rebuild.
So for Canadians, you have to get health literate?
What we mean by health literacy is making sure that people start to get into the conversation. So right now we're talking about, issues like public-private care. We're talking about health transformation. These are very vague, obscure concepts for people to discuss. Over the past couple of years, we all became armchair epidemiologists. In the same way, we have to become health experts if we're going to get our way through this problem.
But I think for Canadians sitting at home, there are many, in particular in the Atlantic provinces, we saw a lot of the premiers meeting yesterday are saying, I haven't had a family doctor in years. I think if you tell them get health literate, they're kind of like, well, I do the best I can with Google Doctor.
Mm-hmm. I think you lean into a very important issue, and that's that the pandemic asked us to social distance, but we also got really distanced from each other when it came to our relationships. The relationship between you and your family doctor, you and your provider, is at the core of the very best type of care that you have. So I really encourage patients that feel distant from their family doctor to reach out. I know that's very difficult to get that connection with your family doctor right now, and this is why we need urgent action from the federal government and provincial governments to close that gap in time and also close that gap in that relationship.
I just want to come back one more time, though, but a lot of people do not even have a family doctor, and many can't get into an emergency room because often they are now being closed.
There's urgent, immediate action needed by the government. I think this announcement that's coming up today, I hope will help to lead to some of the things that we've been advocating for. Creating an immediate action plan towards retaining our health providers, making sure we incentivize them to stay, making sure that we're focused on creating that space so when people do get into care, which can often take a while and, like you said, is difficult to do, but once you're there, we can actually have space to provide care versus doing administrative tasks or otherwise, and moving towards those team-based collaborative approaches to patient care that we talk about, but we haven't really done a good job in delivering here in Canada. These are immediate things that the federal government and provincial governments can focus on. That way we can get down to the actual work of rebuilding that relationship between physicians and their patients, as well as other providers.
One of the suggestions, it's been discussed by the Ontario Premier, the Ontario Health Minister, as well as in Nova Scotia, and we also heard it from Blaine Higgs, the New Brunswick Premier, is using private services to help lift that burden that the care system is seeing right now.
One of the nuances that occurs within the discussion of private care is really in that area of health literacy. So there's two types of privatization that patients in Canada need to be aware of. The first is private support of a well-functioning, well-resourced system. The second is outsourcing of that system to other bodies that aren't under their oversight or control. And it's the second kind that we're really concerned about, and that I think physicians across the country are really worried about. When you outsource things, you lose control. You often fragment the system. We've all experienced this in the way that our food is supplied, the way that our electronics were supplied over the past couple of years. Disruptions to those systems can wreak havoc in people's lives. And it's really important for us to support the public system and make sure that the privatization we're talking about is not that outsourcing kind.
But right now, the capacity is stretched. And again, I'm going to come back to Canadians who want to get the services and need the services now. Is this not a potential temporary solution?
Once again, it's getting into the conversation and understanding the nuance. What we're often told is that convenience is more important than comprehensiveness. And that's a really dangerous hill to start walking down. When you come in to see a physician or a primary care provider, when you walk away, it should actually fix your problem. And although you may wait in line for a while, It's once you get there that's most important. Sometimes when you access these private systems, they don't actually have all the resources, or they don't cover all the parts of the healthcare experience that you need. And so we need to get into these conversations. I think it's very important that we're at a point where governments are seeing that the status quo is not an option. We talk about all options being on the table. We should also have options to remove the barriers to mobility for healthcare providers across the country to make sure that we can respond to these things. If we start to maximize virtual care in the proper way, if we start to maximize team-based care, I think we can shorten the time for people to get into the system, and we can actually fix these problems without turning to these other options.
You talk about mobility. That's one of the things, getting, doctors who can go from province to province and work, but also international doctors coming into the country. But in the past, there has been kind of some roadblocks that have been put in place by, some other doctors, maybe feeling that they're not trained properly. Do you think, from your perspective as head of the CMA, that this will change, that it's something that doctors will want to see happen?
So the biggest barrier to out-of-country physicians and other providers getting into the system actually lies at the feet of the government. We don't have a consistent national-wide approach to creating a pathway to these people working in the system. I can tell you that physicians across the country understand the stresses that are going on with patients. We want to include more providers. We do want to make sure that they are properly trained, that they are properly tracked, and having a national approach to having these people brought into the system and national standards that could happen through increasing mobility and other approaches is extremely important to us. And we fully support creating that pathway to expand the system, but in a safe, high quality way.
You are also, I have to talk about this, the CMA's first Indigenous president. You graduated high school at 14. You finished your residency at 28. Just talk about how your past experiences shaped the doctor who you are now and the president that you want to be.
When I first started to think about becoming CMA president, and I'm very grateful to the physicians in Alberta whose turn it was to choose the president for my year, I looked around and I saw a lot of the frustration and the distance that was increasing between providers and, the patients that we served. My own lived experience as an Indigenous person, I do understand what it's like to not have a voice. I know what it's like to have people project onto you certain caricatures or beliefs that don't really align with the person that you are. And as I go into the presidency year, I think those lived experiences are going to serve me well, creating those spaces for conversation. And at the end of the day, healthcare is really about relationships. And if we can rebuild that relationship and have all care center around that connection that patients have when they come into the healthcare system, I really do think there's a bright future ahead for the Canadian healthcare system.
I just want to look ahead to tomorrow. There is a report that's coming out about doctors. It's one of the most expansive ones that has happened in quite some time. What do you expect to see from this report?
I think we'll see an acceleration of a lot of the negative things that you've heard about in the news. I mean, it's very common for people to have heard about burnout among healthcare professionals. It's well known that we're struggling with our mental health and with our ability to deal with the stresses of practice. I think what the report will really underlie is that we do have to take urgent action now. We have to rebuild the system so we can focus on that relationship, but it also ends up needing a change in working environments. So it's not just about having more doctors, having more providers, shortening that time for people to see each other, but also creating that working environment where we can thrive and really get what we wanted to get out of healthcare when we first started down this path, which is that relationship and that connection with the people we serve.
I don't know if you can answer this question, but just one final question. One thing you could say right now that would change it and make it better?
Eliminating the things that get in the way of seeing patients when they come into the room. When I see someone for an anesthetic, for example, with electronic medical records, there's often that barrier. I'm trying to keep up with typing at the same time as chatting. If I could go back to the time where I could just have that deep conversation with someone, hear the concerns that they have, I think that would transform the care experience for everyone.
So is that more time for each individual doctor with patients? Is that what I'm hearing you say?
I think that's part of it. I think it's decreasing administrative tasks. It's also decreasing the amount of patients that we have to push through per provider, in the system. There's all these different things that we can lean into, but having that conversation lies at the core of fixing it. And I'm really looking forward to having that over the next 12 months.
Okay, Dr. Alika Lafontaine, I appreciate your time and your insights, and congratulations again on becoming the president of the Canadian Medical Association.
Thanks so much.